Okay guys, just going to go over the brachial plexus. So in the last couple of videos we've looked at the CNS, the PNS, and we looked at the semi-disarticulation and the laminectomy in relation to the different layers. We looked at the dura mater, the arachnoid mater and the pia mater. We started to look at the lumbosacral plexus going down to the lower leg, which we're going to go into a bit more detail in the next few videos. So now I just want to go through the brachial plexus with you. So we've got the roots, the trunks, the cords, divisions and the branches, and here we can see the root values C5, 6 forming the superior trunk, and then 7 the middle trunk, and then 8 and T1 the inferior trunk. And then just quickly coming to the cords as well, we can see the medial and lateral cord, and then the medial and lateral cord are ultimately going to form the median nerve. So the medial and lateral cord coming together to form the median nerve, and then on the ulnar aspect we're going to have the ulnar nerve. So just a way to remember with your hand is you can do the medial and lateral cord coming together, which is going to form the medial nerve, and then on the ulnar aspect the ulnar nerve. So let me just show you on the cadaver what we can see. So here of course we have the spinal cord, and we can see the dorsal roots. These are going to be the dorsal roots, and the dorsal root and ventral root coming together forming the spinal nerve. And then here we have of course the entirety is the brachial plexus. So here we have the root values of C5 and 6, 7, 8 and T1, and then as we come down we can see the brachial plexus coming. This is a posterior view of the brachial plexus, and then we're going to start to look at the branches as we dissect and eventually completely retract the scapula out of the way. So here we can just see the scapula in this posterior dissection. And I just want to show you here running on the anterior aspect, so just anterior to the brachial plexus, and just following on from some of the lectures we've been doing about trauma to the region of the cervical region, neck trauma, neck extension, flexion, and some of the pathologies in relation to that. I also just want to show you the vagus nerve here that we have. So the vagus nerve is going to be running within the carotid sheath, where we have the jugular vein here, which we have here, and of course the carotid artery, and here we can see the scalenus anterior. So, and here of course all of this is going to be within the sheath. I've cut through the carotid sheath so you can see the three structures. So it's kind of unique to see this from a posterior view. And then of course this vagus nerve is going to continue down, where it's going to become the recurrent laryngeal nerve, which we'll start to look as we go through the dissection. So just a quick recap, as we talked about in the previous video, we've started to look at the brain and the spinal cord. We've looked at the dural layers. We're starting to talk about the plexi. We're looking at the brachial plexus at the moment, and then we're going to remove so we can see the median, ulnar and radial nerve as we go through into the limb. So please just be aware of the structures which are anterior, posterior. We talked about in lectures the erector spinae group of muscles, and now please just consider these deep structures, the brachial plexus, the carotid sheath, and the vagus nerve, and the chasing down of the vagus nerve.